I have a couple free minutes before I go see my next patient. So I'm setting up my charting or my documentation style for my start of care that I have to do later on. A lot of times you hear people say they don't want to do home care nursing because the start of care and the documentation. I mainly only do starts of cares because I'm per diem, and I like to do starts of cares. So starts of cares come with pros and cons. The pros to a start of care is you're going in, you get to set the tone for what you like it to be. You get to do things right from out the gate, or basically you could do things right. I don't like doing revisits after someone else, because I actually like to do things the right way. So if I go to do a quick revisit and I notice that the medications aren't all in, now I have to stop, go call the doctor, get an order. I don't like that, where I would have done it right from the beginning. Not to say I'm perfect, but I feel like just do things the right way so that other people don't have to do your job. Anyways, I'm going on a tangent. One of the things, though, that people don't like is the amount of time that it takes to do the start of care. Because it's all I do, I pretty much know what I need to ask and what information I need to get before I leave the house. Of course, I cannot show you guys the information filled in because of HIPAA. So I'm just showing you the setup of what I do. So I make sure I put down their name, their date of birth, because when you do call the doctor to get the confirmation that they'll sign orders, they are going to ask for the patient's date of birth. I do put the age because when I'm writing my paragraph about the patient, I do add their age, the diagnosis for what occurred or why we're admitting them, their past medical health information as far as other diagnoses that they've been had, a summary of what took place. Most of the times these people are people that went to, or these patients got admitted to the hospital for some reason, and then they're getting discharged with our services. So I write a quick little paragraph about that, because that will be added into the start of care, and that helps you to have an idea of what's going on. The referral, what are they getting? Occupational therapy, physical therapy, nursing, a home health aide, and telehealth monitoring that we offer. So I put a check beside the one that they agreed to, first I put a check or box next to what the doctor actually ordered, and then I put a check if the patient agrees for it. I put the provider's name and number who will be signing the orders, because again, that will come up in the notes several times, saying that verbal confirmation received, that provider blah 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 is to sign home care orders. I'll need to put that in. The height and weight that the hospital or the facility had them at, what insurance they had, because based on their insurance determines if they qualify for certain things like the telehealth monitoring. Are they a veteran? That's one of the questions that they ask. And if they had 2 or more falls in the last 6 months. Their teeth, do they wear dentures, top and bottom? The assistive devices that they use to walk with. Upcoming appointments, I like to write that down just so I could give them a reminder when I'm in the house with them, because a lot of times they don't even remember that they have an appointment coming up, and you don't want them to miss it. If they have any wounds, where are the wounds located? So now when I go into the patient's house, I take their vital signs, I listen to them. Of course, like, when I say listen to them, I mean their heart, their lungs, their abdomen, to make sure that they have bowel sounds, active bowel sounds. I also go through their medications to make sure all the medications match the list, and that they understand how to take them. And what else? See them walk. I look at the house, and then I put the plan in place for everyone else. So this is just a quick summary on what it looks like to do a start of care. They also get a folder that you leave in the house with the agency's name, their number, some type of information covering things that could better their health, fall prevention, hypertension, managing diabetes. You leave information like that. You briefly go over it and you leave it in the home for them to review later on. So that's pretty much what a start of care entails or looks like.